Hey, good morning. This is Doug Field back again with HealthCare Consumerism Radio, joined by my co-host, Brent Macy. We're pretty excited about this segment because we're going to talk about some of the keys to healthcare consumerism. And joining us today is Matt Collins, Director of Product Management for Truven Health Analytics, one of the leaders in delivering unbiased information, analytical tools, and benchmarking services, plus much more. Good morning, Matt.
Good morning, guys. How are you this morning?
We're great. Where are you, in Ann Arbor today, or where are you today?
Yes, I'm out of Michigan today, looking at a gloomy gray sky.
Well, we've got 70-degree weather in Atlanta, so we won't talk about that on the program. We'll more focus on the things you guys are doing. Okay.
All right.
Matt, listen, you talk a lot about personalization, the key to healthcare consumerism. Can you amplify that with our audience, please?
Sure, absolutely. So, the keys that we've found to engaging consumers really wraps around personalization, making sure that how we're communicating with that member or that employee is personalized directly to them. And this starts with the imagery that we put on the communications, to how we're speaking to that person, knowing how that person, based off of demographic factors, is going to respond to what we're communicating to them about, whether they're afraid to go to the doctor, they're afraid of the costs associated with going to the doctor, and tailoring a message that we're communicating to that person specifically to those attributes. And then also bringing in claims information so we can not only personalize it with how we'd like to speak to that person, but also speak to that person about their healthcare consumption and how they can change their behaviors to be a better healthcare consumer.
How are you actually doing that, though, Matt? Talk to me about, how you, engage with that consumer about that.
Sure. So what we're doing is we have a year-round activation suite. Mm-hmm. And it really starts at the point of enrollment with the user. We like to help guide the user through enrollment from beginning to end. In other words, we'll help that user see what their healthcare consumption was based off of their prior year. And then we'll ask a series of questions to find out what that user's planned healthcare consumption is going to look like. And in turn, we help recommend that user what plan is best for them. So in other words, we'll take all of that information that they've provided retrospectively and prospectively, put that through benefit plan definitions, and help that user choose the right plan. So there's a personalized plan selection piece to this. Mm-hmm. But then it doesn't stop at enrollment. It actually continues throughout the year. Some of that happens with price transparency, especially with the advent of high-deductible health plans. We like to be able to help the user know how much going to a provider is going to cost them. And not only how much it's going to cost them, but how that cost is going to apply to their benefits. So that's that personalization where we're taking in claims data to help the user understand how much something is going to cost approximately, and then take benefit plan information and accordingly help that user understand how much their personalized out-of-pocket cost is going to look like. And then lastly, we also engage that user throughout the year with messages about the gaps in care if they have chronic conditions, helping to remind them that, hey, you have diabetes and you're overdue for your HbA1c exam. Preventive screenings, the people that don't have chronic conditions, or that do, for that matter, if they're overdue for a mammography, as an example, we can send them a personalized message to their preferred method of communication, whether that's through SMS text, through email, or even through the mail. And they'll get that personalized message that will speak directly to them about those preventive screenings or gaps in care, or even cost savings. And that's really where a lot of people manage their health care is through their pocketbook. So we like to be able to help people understand that, hey, you're on a brand drug. You could possibly be on a generic drug. So again, personalization by looking at claims data. That message shows up in their mailbox. They look at it. It speaks to them through the imagery, as I was mentioning earlier. And the message really hits them at home, not only from a healthcare perspective, but also from a financial perspective.
Matt, in the earlier segment, we talked a lot about private exchanges. Does does your solution, does it have a role in helping the private exchanges achieve their goals through the transparency that you all can provide?
Absolutely, and I think I think also this starts at that point of enrollment, that point of initial engagement with folks that really probably a large percentage of them not being as familiar with healthcare in general. So to help them not only understand which plans may be the right fit for them by giving them a decision support tool during the time of enrollment, but also a price transparency solution that maybe even before they become a member in that exchange, they have the ability to model plans and see how much certain procedures are going to cost with the plans that are being offered. And then, of course, as they become a member, there's quite a few solutions that I've already talked about that will assist that member. Price transparency being a significant one to help people find not only how much something is going to cost, but to find providers in their area and to get quality indicators for those providers. But then the other piece to that also is to keep those people healthy once they are in the exchange. Make sure that they receive the messages talking to them about their preventive screenings, their gaps in care, so that they can maintain a healthy lifestyle and actually not be a burden on that exchange that is taking them in.
Very interesting. So you're helping them pre-plan decision and then afterwards become better consumers of health and healthcare, like we talk about. So.
That's exactly right. And one other thing to mention, too, is that as part of the ACA regulations, there is a stipulation about providing a treatment cost estimator to members so that people can go out there and find out how much those procedures are costing. And we're working with a couple of exchanges where they really want to get that cost estimator out in front of their members first and foremost, even before they become a member, so that they, again, can model those plans. They can see how the gold, silver, bronze plan will interact with providers in their area to find out how much they are going to pay out of pocket for services rendered.
Do you see more and more employers leaning forward, having a better understanding about the importance of transparency solutions to offer their employees?
Yeah, again, I think as the high deductible health plans continue to grow and grow in popularity, they're hearing that from their employees is, hey, we need something to make better informed decisions for where I'm going to go get my care because of this wide disparity that you see in markets all across the U.S. For the cost of care, the amazing gap between a colonoscopy in the same area can vary wildly, 20 to 100% differential in the price ranges that we're seeing in our database, our book of business data. We've gone through and carefully mined through it, looking at price disparities across the U.S. and the amount of disparities that we're seeing with very common procedures is pretty mind-boggling. And I think that to provide these solutions to employees as they have much more skin in the game, certainly as with these consumer-driven health plans, they need a tool like this. They need the tool, A, to find out how much that out-of-pocket is going to look like based off of their current deductibles, but then also find that right provider in their area that's going to be have a nice mix of both low cost as well as quality indicators.
Matt, I think with your solution, and correct me if I'm wrong, you have multiple channels that you could actually sell this product to. Obviously, the employer is an important channel, but then health plans, brokers, consultants, are those also channels that you all look to touch to make them aware of these products?
Yes, absolutely. You're right on. The employer is certainly a space that we look to bring these solutions to. Health plans, equally so. We work directly with health plans in getting these solutions out there to them. And then also we do channel through brokers and consultants, as you mentioned. Predominantly right now the business that we see is more so in the employer and the health plan market, but then it's picking up also in the consultant market. I think consumers are getting wiser and they're knowing more to ask for these types of solutions, because in the past it was really more flying blind, especially from a transparency aspect, because people just got used to going to the doctor, paying their $20 copay, and then not seeing another bill after that. But now it's a big wake-up call where people are going in and they're paying a lot of money out of pocket, and they want to know about that before they go in. And we actually the solution also is working out well in the provider space too, because on the flip side of that, you have these doctors' offices that are having people come in, and instead of just that $20, $30 copay, they've got a significant amount of out-of-pocket due at time of service or afterwards, and they may not necessarily expect that. So these provider folks want to also be armed with that information so they can let that person know either, hey, you know you're going to owe this much, or roughly this much, or B, we want to collect some of this before you leave today, because this is going to be a lot more than your copay was in the past.
Yeah, and the provider also, through this better educated consumer, needs to understand how to answer questions they've never had to answer before, correct?
Exactly. Yep. And that's the way we like to lay it out too with these solutions, whether it is the consumer going in, getting information about how much their out-of-pocket is going to look, or even for the provider, to be able to not only provide the relevant financial pieces of information, but also provide the health education piece of information too. And so we marry the two, so you can go out to the solution, you can get that, what is my out-of-pocket going to look like, but you can also dig deeper into what exactly is this procedure my doctor is telling me to get. Now, I know it's going to cost me $1,000 out of pocket, right, but what's going to happen? What is it going to feel like? What are the repercussions of this procedure? And why is he even pointing me down this path? A lot of people in their primary care in the primary care setting don't necessarily have that time to sit down with their doctor to get that full detailed information. So we'd like to supply that to the user as well, so they can really get a deep dive of what it is their provider is recommending.
Matt, I appreciate that. Listen, time flies when we're having fun on these segments. We've got about a minute to go, and I want to give you an opportunity to give clear takeaways to our audience about Truven Health Analytics.
Absolutely. So, first of all, thank you guys both for having me on the show. I really appreciate the time to be able to get on a radio program and talk about this stuff that I feel very passionate about and that my company is so passionate about. But I think that the main takeaway here is personalization. The shotgun approach has really run its course from a consumer communication perspective, so personalize as much as possible, utilizing as much data as possible, and that certainly is a cornerstone to our business at Truven Health Analytics. But bringing in that claims data and being able to utilize that to help people not only understand where they should be reminded about the health care that they're missing out on, but also using that data to help people get accurate estimates for the cost of things. And lastly is really this concept of consumerism is going to become vital to the exchanges, to people that, again, have not been in healthcare perhaps ever, are now going to be entering this new market, and they need to be very educated, because it is not an easy system to navigate. It's quite complicated. Even us in the industry have a tough time navigating it. So I think it's going to be paramount for the exchanges to have these types of solutions.
Well, thank you, Matt. I really appreciate you being on our program this morning. You have a great weekend. And for our audience, you can find Truven Analytics and Matt at Forum East this May 9th, 10th in Atlanta. Also, they are a corporate member on our website at theihcc.com. To our audience, we'll be back shortly.
A public